The doctor is in this morning, and we are talking about bariatric surgery. Who are the best candidates? Why would you choose it instead of perhaps weight loss drugs or other options? Joining us this morning with some answers, Dr. Tallal Zeni, bariatric surgeon with Trinity Health IHA Medical Group. Doctor, thank you for coming in.
Oh, very nice to be here, Dina. Thanks.
So this time of year, do you find that more and more people are asking you about the potential for bariatric surgery? Does it tick up, or do people not want to deal with it during the holidays?
Well, during the holidays, I would say they're kind of preoccupied, but definitely in the new year, that's a New Year's resolution to lose weight and get healthier.
So let's talk about this weight loss struggle. First of all, when you talk to patients about bariatric surgery, potentially, psychologically and physically, all of that, who do you say would be a good candidate for surgery? When is it time to turn to surgery?
Well, patients often decide when it's the right time for them, but they should consider their weight, their other health conditions. So the National Institute of Health back in 1991, so more than 30 years ago, established criteria for it. If somebody's about 75 pounds over their ideal weight and they have medical conditions like diabetes, high blood pressure, sleep apnea, they're a candidate. Or if they're more than 100 pounds over their ideal weight, even if they don't, then they're a good candidate for surgery.
Let's talk about these weight loss drugs, doctor, that seem to be very popular and seem to be working in some people. So Ozempic, Wegovy, and others, the semaglutides. When is that an option, and when is surgery an option?
Well, I think something that many people don't know is that the surgery itself not only, makes the stomach smaller or bypass part of the intestine, it also increases levels of those GLP-1 agonists. And so you're really getting a 2-for-1 with the surgery. Now,
so you're saying the surgery, just to dumb it down for the rest of us out here, doctor, the surgery has an impact on your hormone and brain chemistry the way the drugs do?
Absolutely. It increases those same GLP-1 agonists. So surgery is, in general, more effective than those medications. Now, the medications from the past would, on average, only lose about 8% of total body weight, whereas the newer ones, like the Wegovy or the Zepbound, which is Mounjaro, lose about 16 to 20% of total body weight. But this is less than the 25 to 30 to 35% that a person can lose with bariatric surgery. And I'd also say that, surgery involves a permanent change to a person's, stomach or intestine. So that's always going to work for you. And again, it does have that effect on those digestive hormones, your metabolism, so that it's a long-term change. But those medications are definitely effective and are alternative for people who aren't ready for surgery.
Right, it is an option. Okay, so what does the surgery at this point, now in almost 2024, has it gotten less invasive, a little easier recovery?
So I've been in practice since 2005. I did a fellowship in laparoscopic surgery, and so I've been doing laparoscopic surgery since then. I've done nearly 4,000 surgeries. There's also the addition of robotic surgery, and both are pretty equivalent in my view, but the surgery is definitely minimally invasive, and people recover faster, less pain, and much safer than when it used to be done in the 90s and early 2000s.
And I do know this, doctor, from previous stories I've done, it is a tool, but there's a lot of hard work to be done after you have the surgery to maintain and to stick with what you're supposed to be eating, right? Yeah,
there's a lot of education. Our dietitians are great. We have a comprehensive program all to support the patients. There's, maintaining a high protein diet, low sugar, low fat diet, and that needs to be a lifelong thing. Taking vitamins.
Very good. We're going to continue the conversation in our next hour. We'll talk more about specific surgeries and long-term, how do you keep the weight off? Dr. Zeni, thank you so much.
Thank you.
Hi, this morning the doctor's in. We're talking about bariatric surgery. It might not be something you want to think about going into the holidays when you got a lot of stress from all kinds of things, but certainly maybe in the new year. And the doctor says it might be an option for you even if you think surgery is something you don't want to ever consider. So Dr. Tallal Zeni, who is a bariatric surgeon with Trinity Health and IHA Medical Group. Doctor, welcome back.
Thanks, Tina.
There are so many people out there who could have the surgery and don't. What does it take usually to get them to the point where they say, you know what, I'm going to go through surgery to lose weight?
You know, people have usually tried many different options, whether it's diets on their own, medically supervised diets, or medications. And once they've tried that, I think they realize that surgery is their best course of action.
So let's talk about some of the myths that sometimes come with surgery. And of course, surgery is surgery, doctor. So it is scary, right?
For sure.
But there are some myths that people maybe are walking around with. And one of the first ones is that it's an easy way out. And we know that that's definitely not the case, right?
Definitely not an easy way out. Early on, you know, definitely have to have the surgery. There's pain involved. Fortunately, it's a lot less pain now with the laparoscopic surgery. Usually people are in the hospital 1 or 2 nights. Their recovery time's about 2 weeks. They're usually off pain medicine within a week of surgery. And so, you know, they can see the light at the end of the tunnel, you know, with that, with the laparoscopic surgery.
One surgery fits all. So that's one of the myths, because there are several different types. Just give us a brief explanation of your top 3 types of bariatric surgery.
So as you said, I perform 3 main surgeries: sleeve gastrectomy, and that's where you're removing about 80% of the stomach in a vertical fashion. The second one is gastric bypass. You're making a small stomach pouch, and then you're bypassing about 25% of the intestine. So there's a combination of restriction and malabsorption there. And then third is the Zeni surgery, which is basically a sleeve along with bypassing about 40 to 50% of the intestine. And again, all these surgeries result in restriction, but they also result in the change in the digestive hormones like the Ozempic would do. And so people have less hunger and cravings.
It is interesting, doctor, not to get too deep on the intricacies of the surgery, but those digestive hormones, they're in the lining of your stomach or your intestines? Is that how it alters sort of the way you're thinking about food up in your brain? It's such a interesting connection, isn't it?
Absolutely. So these hormones like the Ozempic or Wegovy or the Mounjaro or Zepbound are made by your body originally, and or the forms of it. And after surgery, they are increased. They're made in the intestine. And so they really work in a number of different ways. They decrease your hunger and cravings. They also slow down emptying from the stomach and slow down movement through the intestine. So that makes a person feel full for longer. And they also enhance your body's sensitivity to insulin, so that insulin helps get glucose into your blood cells instead of making fat.
Very good. Well, certainly interesting and something to put on your, as you're thinking about things, that maybe changes you're making in the new year, something to definitely consider. Dr. Zeni, thank you so much.
Thanks, Dina.
Good information. We'll take a quick break and be right back.